Today, we will explore Barrett's esophagus, a condition where the esophageal lining changes, increasing the risk of esophageal cancer. We'll cover stages, surveillance, endoscopy, biomarkers, evaluation, therapy, genetics, lifestyle, surgery, ablation, counseling, and management in this complex field. Let's begin. Barrett's esophagus is classified into different stages based on the presence and degree of epithelial dysplasia. Epithelial dysplasia refers to abnormal changes in the cellular structure and organization of the esophageal lining. These changes can range from low-grade dysplasia to high-grade dysplasia, with the latter being associated with a higher risk of developing esophageal adenocarcinoma. Understanding the significance of each stage is crucial for appropriate management and surveillance of Barrett's esophagus patients. Surveillance plays a crucial role in the management of Barrett's esophagus patients, as it allows for the early detection of dysplastic changes and the prompt initiation of appropriate treatment. Various surveillance strategies, such as endoscopic surveillance and advanced imaging techniques, are employed to monitor the progression of Barrett's esophagus and detect any signs of dysplasia. The frequency and timing of surveillance procedures are determined based on the patient's risk factors and the presence of dysplasia. In recent years, significant advancements have been made in endoscopic techniques for the management of Barrett's esophagus. These techniques include endoscopic mucosal resection, EMR, endoscopic submucosal dissection, ESD, and endoscopic ablative therapies such as photodynamic therapy, radiofrequency ablation, RFA, and cryotherapy. These minimally invasive procedures offer an alternative to surgical interventions and have shown promising results in the treatment of Barrett's esophagus. Molecular biomarkers play a crucial role in predicting the risk of cancer progression in patients with Barrett's esophagus. Through genetic and proteomic profiling, specific biomarkers can help identify individuals at a higher risk of developing esophageal adenocarcinoma. These biomarkers can aid in determining the appropriate surveillance strategy and guide personalized treatment decisions for patients with Barrett's esophagus. Histopathological evaluation of Barrett's esophagus biopsies is essential for accurate diagnosis, staging, and risk assessment. This evaluation involves the examination of tissue samples obtained during endoscopy for the presence of dysplasia, degree of cellular atypia, and architectural abnormalities. Pathologists play a critical role in interpreting these biopsies and providing valuable information that informs patient management. Acid suppression therapy, usually achieved through proton pump inhibitors, PPIs, is a mainstay in the management of Barrett's esophagus. By reducing acid production, PPIs help alleviate symptoms and promote healing of esophageal mucosa. Furthermore, studies have suggested that long-term PPI use may reduce the risk of progression from Barrett's esophagus to esophageal adenocarcinoma. However, the optimal duration and dosage of PPI therapy, as well as potential side effects, remain subjects of ongoing research. There is growing evidence indicating a genetic and epigenetic component to the development of Barrett's esophagus. Family studies have shown an increased risk of developing the condition in individuals with affected relatives, suggesting a familial predisposition. Genetic and epigenetic alterations, including DNA methylation and chromosomal abnormalities, have been identified in Barrett's esophagus patients. Understanding the underlying genetic and epigenetic mechanisms can potentially lead to targeted therapies and improved risk stratification. Translational research plays a vital role in bridging the gap between basic science discoveries and clinical applications. In the field of Barrett's esophagus, translational research aims to identify novel therapeutic targets and develop innovative treatment strategies. This includes investigating the role of immune modulation, targeted therapies, and potential combination treatments to improve patient outcomes. There is a strong association between lifestyle factors and the development of Barrett's esophagus. Obesity, a high-fat diet, and smoking have been identified as risk factors for the development and progression of the condition. Understanding the influence of these modifiable factors is crucial for implementing preventive measures and lifestyle interventions to reduce the incidence and impact of Barrett's esophagus. In cases where Barrett's esophagus has advanced to high-grade dysplasia or early-stage esophageal cancer, surgical interventions may be necessary. These interventions range from minimally invasive procedures such as endoscopic resection to more extensive surgeries like esophagectomy. The choice of surgical intervention depends on the extent of disease, patient factors, and the expertise of the surgical team. Radiofrequency ablation, RFA, is an effective treatment modality for Barrett's esophagus with dysplasia or early-stage cancer. RFA works by delivering controlled electric energy to the esophageal lining, resulting in the destruction of abnormal cells. This technique has shown high rates of complete eradication of dysplasia and a decreased risk of disease progression. Understanding the mechanisms and efficacy of RFA is crucial for its appropriate utilization in the management of Barrett's esophagus. Patient counseling and education play a crucial role in the long-term management of Barrett's esophagus. Patients should be informed about the nature of the condition, potential risks, and the need for surveillance. Prognosis, treatment options, and potential lifestyle modifications should be discussed in detail to help patients make informed decisions. Additionally, addressing psychosocial factors and providing ongoing support are vital for optimizing patient outcomes. In conclusion, Barrett's esophagus is a complex condition that requires a comprehensive understanding for effective management. This lecture has explored various aspects related to its classification, evaluation, treatment, and patient counseling. By staying up to date, medical professionals can improve patient care and outcomes. Thank you for your attention.